My name is Al Amalados and I'm the Deputy Medical Director for Medical Education for Sussex Partnership NHS Foundation Trust. And on behalf of the Trust, I would like to welcome you to your new posts. We are a large mental health organisation. We provide services in West Sussex, East Sussex and Brighton and Hove out of over 140 sites. We have about 100 junior doctors working with us, together with a similar number of consultants and associate specialists.
Recently we expanded a lot the foundation posts in psychiatry because there is a national drive to have as much exposure to community posts and mental health posts for foundation doctors, because you can develop generic skills that are useful for any career, but also for foundation doctors to have experience of mental health. 1 in 5 of the population will develop mental health problems, so it will be almost impossible to do any career in medicine without coming across someone with a mental health problem.
East Sussex is a wide geographical area with 2 big urban centres, which is Eastbourne and Hastings. Both of them have an inpatient centre, an acute centre. One in Eastbourne, which is the Department of Psychiatry based at the DGH, and one in Hastings, which is on the Conquest side and is called Woodlands. Each locality then has a community centre, which is St Mary's House in Eastbourne and Cavendish House in Hastings. There are a couple of other allied centres, particularly in Eastbourne and Millwood and Uckfield, plus a couple of other outlier inpatient units, which are Beechwood in Uckfield, which is a dementia unit. There is Amberstone, which is a rehab unit, and there's also a large centre for forensic patients, which is the Hellingley Centre.
Hi, my name's Michelle Travers. I'm the locality tutor for East Sussex. We have weekly academic teaching here at the Department of Psychiatry. This is protected time. We also have something similar offered in Hellingley, which is once a month. If you have any questions about your rotation, please feel free to contact me at any time. I'm available by phone or by email.
Hi, my name is Parav Patel. I'm a current FY1 working at the Department of Psychiatry, specifically on Amberley Ward and Bodiam Ward. The Department of Psychiatry is the inpatient ward that's located next to Eastbourne District General Hospital, and it has 3 wards: Amberley Ward, which is the female inpatient ward, Bodiam Ward, which is the male inpatient ward, and Heathfield Ward, which is the old age mental health ward. Like most kind of hospital settings, so you start off in ward rounds, and it's quite different to the hospital setting because patients come to you, which is quite a different experience if you're not used to it. So you're able to kind of sit down, go through and kind of interview the patients. At first it can be kind of a bit of a daunting task. You won't be expected straight away to kind of lead the interviews and to lead the ward rounds. You'll be guided through by your consultants, and you'll see firstly how they work, how they interview patients, and the different approaches that they take to patients who have varying mental health conditions.
So my name is Dan Fitzpatrick. I'm an FY1 currently working on Heathfield Ward at the Department of Psychiatry in Eastbourne. The patients are all generally quite lovely and the staff are really great. It's a very supportive environment. Most of the medical side of things, so patients, just because they're on a psychiatric ward, they're still patients who are on warfarin and need blood checking for that, or they get chest infections and water infections still. So sort of in a way, a bit of the medical authority on the ward. But it is good, and if you are worried, you can talk to the medical on-call team and they're always very helpful.
My name is Greta Koss-Nielsen. I'm a core trainee psychiatry and I work here at the Department of Psychiatry in Eastbourne, currently based on Amberley Ward. And we see a wide variety of psychiatric presentations with patients, acute psychosis, substance misuse, eating disorders, and lots of sort of personality disorder crisis. We have to deal with a lot of both social problems as well, which means that we work very closely with other agencies like social services, children and family services, even forensic and substance misuse services.
My name's Craig McEwen. I'm a core psychiatry trainee in East Sussex. I currently work in the community in an older person's community mental health post. So in my normal day job in the community, I have clinics once a week. I also have visits that I do every day. That's my normal day job, and then I have my on-calls as well, seeing patients on the wards, doing admissions, answering medical emergencies, seeing patients in A&E, and also looking after a few outlying wards in different locations as well. Sometimes patients come to A&E to present in distress or crisis, or if they've taken an overdose or self-harmed. A&E will always check them over medically first and make sure that they're well. They get referred in during the day to a liaison team we have here who are full of nurses and some doctors. And in the evening we have a night practitioner nurse who sees everyone in A&E. Sometimes we're asked to go in as well for a bit of help or to offer an opinion, or if they're really busy, to see patients as well.
In psychiatry, we expect that roughly on a weekly basis, you get an hour with your supervisor, either educational supervisor if you're a CTO or a higher trainee, or a clinical supervisor if you're a GP trainee or a foundation trainee.
My name's Edward Lepper. I work for the Mental Health Act Department in Sussex Partnership. My role is the Practice Development Officer for Mental Health Law, which means I'm a trainer for people on the Mental Health Act and the Mental Capacity Act. For junior doctors, we're going to do a training session around their responsibilities under the Mental Health Act.
The teaching that's on offer comes both formally and informally. Informally, you get kind of hands-on teaching with your consultant, and that will be specifically in the ward rounds or separately afterwards. There's also the formal academic teaching on a Wednesday afternoon for the East Sussex and also trust-wide. They're usually held in the Department of Psychiatry or one of the other sites at Hellingley. And these are really good where you can present patients their critical appraisals, and there's also guest speakers as well who come in and talk about really interesting topics.
We also have Balance Group. It's an opportunity for us to talk about any issues with patients that we've come across we found particularly difficult.
There's also a teaching session which brings together all the localities in the Sussex Partnership Trust, and you get kind of a broader range of teaching, whether that be on kind of CBT, psychology, and loads of other topics which aren't covered in your kind of local area teaching that you do get experience to as well, which is also really, really helpful.
When you start CT1, every other Thursday you go to Hove and take part in MRC Psych teaching to prepare you for the MRC Psych examinations. The course is run by Brighton University.
Here I actually am allowed time to further whatever I want in my professional development. So when I started, I said I'm interested in teaching, I enjoy teaching, and the consultant has set out a timetable 2 hours a week for me to teach students, and that's taken away from my clinical responsibility, and I'm allowed to do that, and that flexibility you wouldn't ever find in medicine or surgery.
Support-wise, obviously there's the consultant, and then there's also a staff grade who are very good at supporting with sort of the psychiatric things and teaching me and sort of giving feedback on things I've been doing. But I've also found the nursing staff, in particular the really senior nurses, to be an excellent source of advice.
Hello, my name's Jackie Newton. I'm the ward manager on Heathfield Ward. Heathfield Ward is one of the 3 wards at the Department of Psychiatry. We have rotation doctors here all the time. All the nurses are very friendly. Myself, you can approach us at any time about anything. We're here 24/7 and we really look forward to seeing you.
The pharmacists are around in the building every day and check what we need of medication, they check our job charts, and again they're at the end of the phone if we need advice.
Every junior doctor from the beginning of their job will know what their work schedule is and what their worked hours should be. If at any time they work in excess of those hours, then what they should do is to enter what's called an exception report, saying when they worked over, how much longer they worked over, and what was happening at the time, and then submit that. That will go to their educational supervisor, and a copy of it will also go to me as the guardian of safe working hours.
Feedback is also really important as well. and especially in the East Sussex area, you're given a designated 1 hour feedback session each week with your consultant, which isn't a formal session. You can talk about anything, but the consultants are scheduled to have that with you. So that provides kind of an up-to-date weekly review of how your week's been. So all those areas really help kind of tie things together and what you've learnt, and help to kind of provide a really good, enjoyable placement.
When you start on your placement, there's a doctor's handbook that you're given, and that has all the information you need on it for your first on-call, for your where to access things, how to access eSearcher to get bloods, and that's all the information in there.
Obviously, when it comes to kind of the management of patients, again, that won't be something that's going to be expected of you straight away, but it's something which by the end of the rotation, you should start to feel a little bit more comfortable with knowing what common medications are used and when it's appropriate to use them. And specifically for foundation year doctors, they don't expect you to become psychiatrists by the end of the 4-month rotation. The rotation is there so that you get an understanding of what happens within the inpatient ward, because there are a lot of preconceptions about psychiatry, specifically in the inpatient wards.
The patients are incredible. The presentations of people who are really unwell is really interesting to me. But also in psychiatry, I just get the time to spend time with patients. If I'm having a difficult consultation, I can take an hour and there's not 30, 40 patients waiting for me like you get in medicine or surgery. You have the time to do that, you have the support, the patients are fascinating, and I really enjoy it and find it really rewarding.
I've really enjoyed my psychiatry rotation. You see a whole range of psychiatric presentations, and it's a really good opportunity to see a kind of a progression of a patient's condition and how knowing that kind of your interventions have really managed to make a difference. You really get the sense that you're treated better and you're really appreciated on the psychiatry, because they want you to learn and they want you to engage in these things.
I hope you have a good experience with us, that you do learn what you've set out to learn, and hopefully more than that. Any issues which arise, please do bring them up with your supervisors. If you're not happy with that, there's always me. You can come to visit or email or phone, and there's also the medical education manager.
You will always come across people with psychiatric illness, and you need to be able to recognize that and at least have a discussion about how their problems can be managed. I do hope that your time with Sussex Partnership will be a profitable experience for you, and that you will learn as much as you possibly can in the 4 or 6 months that you are with us.